Hi, Dr. Yas here. I just want people to understand just how invalid the existing system is in addressing your pain. Just imagine if you had pain at your elbow and I told you for the next 10 years I was going to provide treatment to your ankle. I would imagine that after the 10 years and you still having pain at the elbow because I was treating your ankle, you would understand that there was a good reason why you didn't have any pain resolution. Well, the same exact thing is happening, but it's in a way that the average person doesn't fully understand. So let's say that you had a muscle and spasm in your lower back, and that was causing your pain. That doesn't show up on an MRI or any diagnostic test. But what does show up on an MRI is stenosis or herniated disc. So if you had pain, you're typically going to go to the medical establishment. They're going to take an MRI. They're going to find stenosis. And for the next 10 years, you are going to be treated for that stenosis. You're going to get medications. You're going to get epidural nerve blocks, probably multiple surgeries. You're going to be left in pain after 10 years. And you're confused why after everything that's been done, you're still in pain. It is the exact equivalent to you having pain at the elbow and the medical establishment treating your ankle. That's how bad this is. Two quick examples. A gentleman I come across having pain for 30 years. 30 years this guy's been writhing in pain. So much so that he had a Dilaudid pump put in him, a pain pump, which allows him to press a button to elicit a release of pain medication in his body to, as he describes, simply allow life to exist. It doesn't resolve his pain. It just makes life bearable. That's how he described it. 30 years he's like this. I happened to come across him, do an evaluation, established that the cause of his pain at his shoulder was muscular, did a basic treatment. He increases range of motion at his shoulder 40 degrees and sees a major reduction in his pain level. It was a stunning testament to the fact that for 30 years, this guy is having elbow pain and they're treating his ankle. He was told he needed a shoulder replacement. It's arthritis. It's all this. It was muscular. But no one can identify that because that doesn't show up on any kind of diagnostic test, or there's no medical specialty capable of identifying it. So this guy gets to suffer for 30 years because of the ineptness of a system. Another guy is told that his pain that he's been suffering for at his front thighs is the result of stenosis at the lower back causing sciatica. Well, sciatica has nothing to do with the front thigh, and sciatic symptoms have to pass the knee. So this guy gets to suffer for 10 years. The guy becomes debilitated. He falls constantly. He needs to use a rolling walker to stand or walk, and he still is that unstable. I come in, massage out his front thigh muscles, strengthen his front thigh muscles and some other hip-related muscles. The guy is able to take a few steps now, even without using a rolling walker. It is a monumental change. His pain level at his front thighs completely resolves. 10 years this guy suffers. Why? Because he has pain at his shoulder, and the medical establishment is treating his ankle. You do not have to go through this process. You don't have to live for years in pain because of an inability to identify the proper tissue releasing that symptom. The Yas method is the only method. It is the only way of diagnosing what tissue is eliciting that pain, and helps you to identify it and treat it appropriately. Don't spend years with pain at the elbow being treated at the ankle. This is your chance. Find out how to get to the Yas method. Use it. Resolve your pain now. Thanks. Bye-bye.